Well, tonight the CDC says nearly 1,300 measles cases have been reported so far this year across the country, the most in more than 3 decades. The largest outbreak began 5 months ago in under-vaccinated communities in West Texas. 3 people have died, including 2 children, and dozens have been hospitalized. CBS's Dr. Céline Gounder here now with more. Céline, good to see you. So a seemingly small drop in vaccination rates here, from 95% down to 92.7, almost 93. How does this significantly increase the number of people getting sick?
Look, measles is the most contagious infectious disease known to man, which means that you need to have extremely high vaccination rates in order to prevent transmission. In the case of measles, you need 95% population immunity through vaccination to prevent transmission. And what we've seen is vaccination rates have dropped just to, you might say not so far off that 95%, but down to 92.7% among kindergartners in this country, and in some communities drastically lower than that, which leaves us open to having measles transmission, particularly when you have more foreign travel and some delays related to the pandemic.
And that's a lot of people. We were talking about percentages, but that's actually a lot of individuals there, right? And then the virus, it infects immune system cells. That damages your immune system. So how does that impact your ability to fight other infections and other things that are just out there?
Yeah, I think this is really important to emphasize that measles can cause immunosuppression by infecting immune cells that can last months to years. And in fact, when we look back historically over data of childhood deaths, it looks like about half of those deaths may have been from infectious diseases, may have been related to measles immunosuppression. So even if you survive that initial case of measles, your immune system is much weaker for months to years and less able to fight off other infections.
What about all this misinformation that's out there? That's got to be affecting this, right?
Well, it certainly is. And unfortunately, we are seeing that amplified by certain members of the administration, including Secretary Kennedy, who has been known to be a vaccine skeptic, has reinforced this myth that vaccines cause autism. To be very clear, that has been thoroughly debunked. He's also thrown into the mix some restructuring of CDC and FDA branches that address vaccines and vaccine safety and recommendations, which also raises some concerns in the public and may increase skepticism. And so, we are definitely seeing an impact of mis and disinformation on whether people are getting vaccinated.